Welcome to Redeemer Lutheran Church and Compassion Clinic Virtual Health Fair, COVID Edition 2020. My name is Dr. Karen Krigger. I'm a professor in the Department of Family and Geriatric Medicine at the University of Louisville School of Medicine. I also serve as Director of Health Equity of the Health Sciences Center and Endowed Chair of Urban Policy for the university. I want to thank you for joining us in this session on getting the most out of your telemedicine visit with your provider. There are really four kinds of telemedicine. Real-time allows patients and their providers to perform a medical visit in a virtual exam room, allowing the patient and the provider to see and talk to each other in real time. Another kind of telemedicine is store and forward. Images like EKGs and X-rays, data and sound can be transferred from one medical care site to another for evaluation. In your primary care office, you may have had X-rays that have been sent electronically from the primary care office to the radiologist at the hospital for reading. Or you may have had an EKG that was performed in your primary care office, but was sent to your cardiologist to update them on your medical condition. Third type of telemedicine is remote patient monitoring. If you've had a pacemaker, your provider may use the phone lines to send information from your pacemaker in your body, in your home, to their office. Blood pressures, heart rates, heart rhythm are all examples of medical information that can be sent remotely from a patient's home to a medical provider's office. The fourth kind of telemedicine is mobile health. It provides access to health education, information, and other services through a phone line or pre-recorded video session, like this virtual health fair. In this session, we're going to talk about how to get the best experience in real-time telemedicine. Real-time telemedicine requires a video platform. You may be familiar with FaceTime on a phone, in which you can see and talk to someone at the same time that they're seeing and talking to you. That's a free video platform, and chances are your medical provider will not be using that one. They'll be purchasing video platforms that preserve your medical information. Platforms like BlueJeans, Zoom, Adobe, and Doximity and Teams are all video platforms that your provider will pay for to preserve your medical information. How does this work? Well, you'll be given information as to how to connect with your medical provider. If you have an email address, they can send it by email. There'll be a link. You click on the link and suddenly you're in the virtual exam room with your provider. If you don't have an email, but you do have access to a camera in your phone, laptop, computer, or tablet, they may send you to the website like Zoom, where you put in, join the meeting section, the number and passcode you received from your provider's office. This is how you accessed Redeemer Lutheran Church's Compassion Clinic Virtual Health Fair pre-recorded sessions today. If you don't have an internet or camera on your phone, laptop, iPod, or computer, you can still do telemedicine through the telephone. You'll be given a phone number by the provider's office to call at the appointment time. You can do this today in our Ask the Doc sessions. Our toll-free number on September 19th, 2020 is 1-404-458-0105. So your medical provider's office can provide you with a phone number so you can actually call in and talk to your provider at that time. What should you expect to happen? Well, your provider's office should contact you a little bit before your telemedicine visit to make sure you have the necessary information to log in. They should also make sure that you're comfortable and can navigate the video medical site successfully. The medical office may also verify your insurance if they've not done so in a prior visit. They also want to make sure you have a good phone number that they can reach you if there's a problem on the provider side with technology or delays in transmission. Because of COVID-19 CARES Act, which stands for Coronavirus Aid, Relief, and Economic Security Act, there's no copay for telemedicine visits through October 30th, 2020. If your provider does not take your insurance or you don't have insurance, the medical office may require payment before the telemedicine visit. What can you do to prepare? When you schedule your telemedicine appointment, make sure you are in a secure, confidential location while speaking to your provider. You don't want to share your medical information to other people unless they're part of your care team. Your medical provider is also going to prepare by being in an exam room, either in the office or their home in a secure, confidential location. They want to protect your medical information too. You may see them wearing a headphone set to keep your conversation private. You may even hear a noise cancellation device going on in the background to prevent others from hearing the conversation. Your internet connection may influence how successful you're going to be able to communicate during your telemedicine encounter. If you don't have enough bandwidth or internet strength or internet speed, you may not be able to see and hear your provider at the same time. Try turning off the video portion and see if the audio portion improves. You may get an echo if you have the meeting site open on your phone and your laptop at the same time. Like if you're trying to include someone else on the visit, the echo will happen if these devices are too close together. Turn off one of the devices to fix this problem. If you want someone to join the telemedicine visit with you remotely, like you need an interpreter, ask for the toll-free phone number from the medical office so they can dial in and be part of your encounter. You can be prepared by having the following things available. Most importantly, have your medications and an ink pen with you. The medical office staff may want to review your medications with you before the doctor comes in the exam room so they can update your medication list just like in the medical office. Or the provider may change a dose or timing of a current medication. Having the bottle in front of you allows you to make the changes with a pin on the bottle or packet. If the medication is discontinued, you can put an X on the bottle. The medical provider is going to ask you some questions before the medical visit starts. They'll ask, where are you? Are you in a safe, quiet, confidential location? They'll also tell you where they are. They may tell you how they are prepared to safeguard your information, like wearing headphones or using a noise cancellation device. They'll identify who you are, especially if they've never seen you before. They may ask identifying information like your date of birth or your address or your social security number. They will tell you that there are potentials for information breaches or technical problems during this encounter that you need to be aware of. They'll inform you that you can terminate the visit if you don't feel your needs are being met by the telemedicine visit and advise you to come into the office for a scheduled face-to-face encounter. Conversely, if the medical provider doesn't feel that they can meet your medical needs on this type of visit, then they will ask that we terminate the telemedicine visit and schedule a face-to-face encounter in the office. You have to verbally agree to continue with the telemedicine visit and express understanding of the limitations that telemedicine has before the visit can start. Since you're not in the medical office, the provider will only have data on your weight, heart rate, blood pressure, temperature, and your oxygen level if you provide it. If you currently have home health services, you can get this information from them to share with your provider during the telemedicine visit. If you have a blood pressure cuff, take your blood pressure before the visit to have that information ready. Your provider may ask to see the cuff on your arm during your telemedicine visit to ascertain whether you are using the correct size of blood pressure cuff. Blood pressure cuff too small will give a falsely elevated blood pressure, and if it's too large, it'll give a falsely low blood pressure. You can take your heart rate by counting the number of heartbeats in 60 seconds. I'd like to demonstrate how to do that. Feel the inside of your wrist on the side with your thumb. Find the bone with your fingers, your second and third fingers, please. There's a little valley next to that bone. Press with your second and third fingers, and you will feel your pulse or heart rate. Count the number of heartbeats you feel in 60 seconds. If you have a scale, measure your rate to have that information ready for your provider. This is important if you're on a water pill or if you have congestive heart failure. If you have a thermometer, measure your temperature. Please tell the provider where you did your measurement, whether it was in your mouth, your ear, or your forehead. If you have an oximeter, that's an instrument that measures the oxygen level, take that measurement as well to share with the provider. Let them know if you're using oxygen and how much. For instance, if you're supposed to be on oxygen, let them know if it's 1 liter, 2 liters, 3, 4 liters. If you're supposed to be using oxygen, but you weren't at the time you did your oximeter reading, let them know that that is a room air result. The doctor may measure your respiration, that is how fast you're breathing in 60 seconds, by observing you on the camera or listening to you talk, and note whether you're becoming short of breath during the medical visit. If you want to show something to the doctor on your body during the visit, you'll have to realize the quality of your camera and the doctor's may influence what they see. Your camera may be better than the doctor's, or the doctor's camera may be better than yours. You'll have to be very, very close to the camera. If you have a home health nurse and the doctor wishes to have labs, the medical provider can send an order to the agency providing your home health services to collect the lab specimens from you in your home on a specified date. If you don't have current home health services, you may have to make a visit to the laboratory. Prescriptions can be sent to the pharmacies electronically, just like in the medical office. Be aware that some medications require periodic documentation of completed lab work, contracts, or external record reviews before the medications are sent to you. If you think you've missed something, you can always request a provider to send you a copy of their notes or office summary from the telemedicine encounter to your mail or patient portal. If you're afraid you've missed some instructions during the visit, don't be afraid to ask. And remember, if your provider is usually late for your appointments in the office, that may happen on the telemedicine visit too. Be patient. You can call the office and get a new estimate of time of the appointment if you feel the wait is too long. If the video platform waiting room closes before you visit, call the office to be put back into the exam room. If used properly, telemedicine is a wonderful tool for people afraid to come into the office because of COVID-19. It's also wonderful for people who have difficulty coming into the medical office because of a disability or because of transportation difficulties. I hope you consider telemedicine as an option to your healthcare needs. Call your medical provider if you have any questions about its use in your medical home. Thank you for allowing me to share this session on telemedicine with you. I truly hope you found this information useful, and I invite you to enjoy the rest of Redeemer Lutheran's Compassion Clinic's virtual health fair today, September 19th, 2020.